made this little presentation for you guys. Oh, sorry. Okay, we just made a small table of contents. So we'll go over like our undergrad application, what our school is like, and then if there's any questions. So well, my timeline was applying to optometry school. I went to GCC for 2 years. I did scholars program. I was a biology major. Some like extracurriculars, I was in Adventist health. That took up like a majority of my time. And then when I went into UCLA, I went to UCLA from 18 to 20. Again, like I did a biology major, and then at UCLA, I was volunteering for Jules Stein Eye Center. So we did like a lot of like preschool screenings, and then they had like a huge research center. And then at UCLA and like towards the end of GCC, I started working at a private practice vision therapy office for about 2 years. I took my OAT summer of 19. So I was going into fourth year, senior year of undergrad. I didn't have much time to study for the OAT. It was kind of like a last minute rush, and I was working. So I studied for about 6 weeks solid. I used like the Kaplan book. I took my OAT early August. I ended up submitting my application August 30th. And then I got my first interview at SCCO, and it was for October 2nd or 3rd. And that was like very early in the cycle. That was like, I think, the second interview date they had. Some like recommendations I have, like, of course, like hindsight is 2020. I would like study like a solid like maybe 3 months and do a lot of practice questions. I did not do enough practice questions, and I kind of crammed my studying, so I didn't have enough time. And then in terms of like the application cycle, mine was pretty quick, and it was like really traditional. I was able to have in-person interviews. So I did the SECO one, which was very simple, like traditional one-on-one interview. They asked like basic questions. There's like 7 questions they ask. I got lucky. The dean that was interviewing me kind of knew the doctor that I was working with. So he didn't really ask me anything aside from the number one question they always ask is, why do you choose optometry? And then other than that, he didn't really ask me any questions. And then I did a second interview at Berkeley in January. I only applied to 3 schools, Western, Berkeley, and SCCO. I didn't like follow through with my Western application, but I got into SCCO and Berkeley. And then the Berkeley interview process, again, it was in person, and it was a little bit non-traditional. So they had a one-on-one interview, they had a group interview, a group project. You had to write an essay, and then there was also like multiple mini interview stations where it was like scenario based, and you had 3 minutes to go in, kind of fake the scenarios, and they kind of test how you think on your feet. So that was that. And then Arpi can give you guys hers. Oh, also, like I didn't take a gap year. I graduated in 20, and then I started that upcoming fall.
Yeah, so I like to think of Kristine as the model student who did everything like in the right order. And my path was a lot more untraditional in a sense. I went to GCC as well, a scholars program. I volunteered through the program, and I took a majority of my, not a majority, like my, I guess, the prerequisites. At this point, I didn't really know that I wanted to do optometry. So the struggle for me was applying with a psychology major. I had taken some courses towards that, and then I decided to go to UCLA with an anthropology major. And I did the BS at UCLA. I was able to fit a lot of my optometry prerequisites while also satisfying like the BA and the BS portion. I also minored in global studies. So there was a lot of overlap with classes, but I was doing something that I really enjoyed. Like my non-science classes were something I really enjoyed learning about. So I was lucky to be able to do both. And then I also got my first job at a private practice, like down the street from UCLA, so it was great. I would go after class, try to learn as much as I could, and took most of my prerequisites here for optometry school, but there were a few that I couldn't finish. So I took some extension courses at UCLA and at Berkeley. And I did end up taking 2 gap years. One of those years ended up being the first year of COVID. So I was studying during peak COVID time. And this was like a blessing in disguise because I kind of had 3 months of absolutely going nowhere. Like I was locked up in my room or at a cafe studying. So that was good. I took the OAT in the summer of 2020. And then I applied pretty early in the cycle. I applied to Berkeley Western SCCO, got interviews pretty early, and SCCO was my top choice, but I got accepted to Western first. So I gave them my deposit, and then I got off the wait list to SCCO, ended up sacrificing my deposit and a scholarship to come here. But it was worth it. We can talk more about the school later. But tips for applying, definitely apply early and get as much work experience as you can, volunteering. They love hearing about the school screenings and things that we do. And then my interviews were pretty similar to Kristine's, except for they were on Zoom. I couldn't go in person to any of them. And one of our professors now also knew the doctor I was working for. So SCCO's interview was more of a friendly conversation, and that came through in the interview. And I think that's what attracted us to the school. Everyone is very personable and friendly and wants to get to know who you are as an individual, not just your academic background. Berkeley's, I would say, was a bit more traditional, and it was like a student and a professor in the same room, and they took turns asking questions. So that was an interesting dynamic. I really did like Western's interview though. I also applied to Chicago and Arizona. I got interviews, but I didn't end up doing them because I got into the 2 here local. So yeah, now we'll talk a little more about our school experience.
Yeah, and then like one of like some of the factors that we considered in like choosing SCCO, like for me, of course, like lifestyle, like staying in LA, if you enjoy like being close to home, and then Fullerton, like the area at SCCO, it's kind of more suburban, calm, versus for me when I was considering lifestyle here versus in Berkeley. I felt like it was a little bit more suburban and safe here. And then also Berkeley was a little too far from home for me. In terms of like cost and proximity, SCCO is a little bit more on the pricier side. It's about around like $50K a year. Versus like most of the schools are around the same, but since Berkeley's a public school, it is cheaper. And then 4th year, when you go off for rotations, they do kind of decrease the tuition versus private schools don't really do that. But I was looking at like costs of living is obviously more expensive in Berkeley versus here. So those are a lot of things to consider. We do recommend also looking at the board pass rates and then like clinical reputation. Like SCCO has a huge reputation, especially in Southern California. So it's also important to consider where you want to work after you graduate. Those are things I took into consideration because a lot of the doctors that do also work in our clinic also have private practices within the area. And a lot of students do get hired through that. But I think like one of the most important things is like board pass rates, make sure it's solid, look at the curriculum. Cost is obviously really expensive, but not just cost of tuition, but also cost of living and also the type of lifestyle you want to have. If you want to stay close to family, if you want to move far away. And Arpi, do you have anything else to say about that?
No, I agree. I feel like I considered all those same aspects. Board pass rates were important. I was iffy on Western because it got its accreditation not too long ago. And I just heard great things about SECO personally, because a lot of the doctors we worked for also went to SECO. So it was just constantly hearing about how like great it is. And also the network of doctors around you are likely going to be SECO grads. So there was a connection there.
Okay, and then yeah, just in terms of like cost, it's important to consider tuition, living expenses, but there's also like other costs. Like some schools include have board prep included into the cost because they have their individual school-made board preparations versus some schools. It's like this like basically it's dependent on the student to pay for their own like board preparation, and the school doesn't supply any. So those are all things to consider. And then also, since fourth year you are going off to different rotations, you should like also consider if the school lowers the tuition for that or not. Those are a lot of like extra costs. And then of course like paying for boards, any board preparations. There's also extra, some schools charge you for equipment, and then some schools expect you to choose your own equipment and buy it. Those are a lot of costs to consider, because if the cost of equipment isn't included into the tuition, then that's also a huge cost. So sometimes it might seem like it's a cheaper alternative, but a lot of things aren't included. And then this is kind of just an overview of what the curriculum is like. So it's definitely lots of like didactic the first 2 years, and it is quarter system. So first year you have fall, winter, spring, and you get the summer off. But then second year you start going into fall, winter, spring, and then summer of second year is when third year begins. And then yeah, the first 2 years you have about like 15 to over 20 units. And then it does become less in third, fourth year. But yeah, second year, you're taking about like 6 to 8 classes a quarter. So yeah, first year is just a lot of like didactic, like core science classes, visual system classes. And then you do learn how to do a full comprehensive eye exam, and you get a little bit introduction into ocular health. And then Arpi, if you want to add anything.
Yeah, I just had my proficiency on the full comprehensive exam. So they're just checking that we know how to do all the skills we've learned over the year. And then over the summer, we don't really practice. So we're going to jump back into clinic in the fall when we come back. And they just want to make sure that we have all the skills necessary to do that. And here is a weekly look into my schedule now. We are going into finals this week, so it looks a little different now, but typically this quarter I had 2 exams a week and at least 1 proficiency a week. And proficiencies, if you don't know, are practical exams. For example, like first quarter we learned retinoscopy, which is just getting a prescription, and then we went into like subjective refractions, and then second quarter learned some more skills. This quarter we learned a lot of the rest of the skills for a full eye exam. And yeah, so this quarter we have anatomy, visual psychophysics, pharmacology. It's our first time taking pharm. We finished optics in the first 2 quarters, and now we have ophthalmic optics, which goes more into glasses and lenses. And then ocular health procedures is like the main practical course where you learn how to do all the skills that are necessary. Neurophysiology is a huge course this quarter, a lot of very time consuming. And optometric clinical services is different every week. Sometimes we go to clinic, which we'll talk about more later, or sometimes we go to lab, and that's the course where we have the proficiency for the full exam. And then my Friday is typically all lab.
Okay, so second year is again like still a lot of courses, but you start taking more like advanced or specialty classes. Like you start taking disease, you expand a lot more on ocular health procedures. You start going into pediatrics, contact lenses, and then this is kind of what like my weekly calendar has been. I think this was from fall quarter. But yeah, very similar. We have 2 exams a week, starting week 3 up until finals week. Um, Again, we still have like the optometrical clinical services course, which you basically have every year. Had a sensory vision class, again, pharmacology. You take a couple courses of that. Again, ophthalmic optics was a continuation. You have disease. You start getting into more case analysis and how to prescribe. And then, of course, like cornea contact lenses. And then we do have about 4 labs. I also had my Friday labs. And then, yeah, just to break down, like, this is kind of how like the month goes. You usually typically have 2 midterms and then 1 proficiency a week. Sometimes you have 1 proficiency every week, but it just depends on the quarter. I think for me, I'm in spring of second year right now, and it was a little bit, I had less proficiencies this quarter than I've had in previous quarters. And then third year is when you start going into clinics. So you have a lot of clinical shifts. You still take a couple lectures, about 4 classes, 3 to 4 classes a quarter. And then a lot of the courses are more like clinical medicine courses. So injections, more systemic diseases, when to diagnose systemic, when to refer it out. And then fourth year is when you do your rotations. So you have 3 sites, 3 away sites, and then 1 site at Ketchum. And for how our school works is we have about 80 different sites across the US. We also have 1 in Alaska, 1 in Japan, and then we have 1 in Hawaii. And then the rest of them are spread out across the rest of the US. Okay, so Arpi will tell you guys, talk more about first year clinic.
Yeah, so first year we started going into shadow students for the most part, like shadowing third or fourth years on their clinical rotations or during their shifts. So that is usually up to the student that you're observing, how much they want you to participate. But typically, at first you observe, so you can sit and take notes, and then you have to submit a form like about your patient encounter. And then it starts getting more involved. You learn how to do like pre-testing. And then the student can also ask you to scribe for them. So you can scribe during the exam, and then you kind of shadow them around the clinic, see how they interact with the attending doctor, or like talk to optical at the end of the exam. And then this quarter, we started going in more for shadowing, and didn't really go too many times this quarter, but Kristine started the second year. She started going in a lot more, and she'll talk about that.
Yeah, so second year, you get to see 1 first year patient. So they come in for a comprehensive exam, and then they also come in the second time for a dilation, which is when you put the drops into the eye so the pupil dilates and you can take a better look at the back of the eye. That happens winter quarter, and then spring quarter, you train an optical department, like glasses, customer service, and then you also get to see your first 2 patients. For me, I brought in my mom and my dad. And then, yeah, you also have those patient assist shifts where you kind of shadow. More so they let you help out in second year, or you also scribe. But usually I like to just watch shadow and like see how they have, like how different students have a different exam flow. And then I kind of judge what works better, or kind of see what works for them, what doesn't work for them, and I try to incorporate that. And then third year, you become an intern in clinic, and then you get to work in different departments. So For me, for example, this summer, I get to be in primary care and ocular disease, vision therapy, and optical. And then fall, I get to do contact lenses, vision therapy again, disease. So it kind of just depends, but shifts go from Monday to Saturday. And it's usually the morning shift is until 12 o'clock, and then the afternoon shift is until 5, 6. Usually you end up staying a little behind to either review your chart or finish charting. And then going into fourth year, again, you get to go to different rotation sites. A lot of like the popular sites are the VA sites. You get to see more trauma, but fourth year, when you come back and do your rotation on site, you go into more specialty departments like low vision, ocular prosthetics. So it is a slightly different than third year. And then our clinic has a lot of departments. So we range from like primary eye care. We have cornea contact lenses, which they do a lot of specialty contact lenses for irregular corneas. And we also have an ocular prosthetics department. We have pediatrics, vision therapy is really popular here. Low vision is also really popular. Disease, myopia control, dry eye management. So we do have a range of different like specialty clinics. So we get to have a range of different departments and also kind of figure out which specialty we would want to continue or possibly do a residency in. And then the good thing about our clinic, we accept most types of insurance and Medi-Cal too, which is hard to find in like this area. So we do get a large range of patients.
And a lot of Spanish speaking patients. So that's definitely a skill you want to brush up on if you plan on attending school in SoCal.
Yep.
Thank you.
Thank you.
Does anyone have any questions? This is your time to ask anything.
I have a couple. I was just sort of writing down like what came to mind, like chronologically. So it might not be what you just talked about, but in general, I guess it's a very general question because it's like a standardized test, but what was the OAT like? And if you're comfortable sharing, what was your score or how was it scored and what was your GPA going into SCCO?
The OAT, I think it was 5 subjects. So it was about like a 5-hour long exam. It had a comprehensive part. It had like biology, organic chemistry,
General chem, bio.
Yeah, physics. Yeah, so it had physics,
it's,
general chem.
Yeah, if you're familiar with the DAT for dental, it's like identical except it has physics.
Yeah.
Different. Yeah.
So just like you like take it as a testing. I think I remember my percentile. I took it like 2 years ago, 2.5 years ago, but I think it was like within like 85 percentile. But like I like also did like a lot of the students that got accepted with me were on a huge range. So some people had like lower OAT scores, but they compensated for like a lot of like experience and higher GPA. And there's also students who had lower GPAs but higher OAT scores. So it's really a range. I think like a solid like range of GPAs that I've personally like encountered is like anything from like a 3.3 to like a 3.8. And then in terms of OAT scores, you definitely need to have over 300. I think having a score of like 340 is pretty solid. Like,
yeah, I think it's out of 400, right?
Yeah, it's out of 400.
Yeah.
Most of the schools have their averages. Usually GPA averages are around like 3.4, 3.5, 3.6. And then OAT scores are usually around like the 340, 350.
Yeah.
Yeah.
I was on the pretty average side. I feel like my experience and personal statement definitely made up for it.
Yeah, having experience is a huge factor. Usually, like the first glance they do at your on your application, they mainly just look at your GPA OAT score. And then like the interview is where you really bring out a lot of like the previous experiences. And one of like the key things that they look for is when you have something to refer back to in an interview. So if they ask you a specific question, you can kind of relate it to an experience you've had in clinic or working or volunteering somewhere. Those are like key things that they like to hear.
Yeah, even in the personal statement questions, like the school specific questions, a lot of them are like relating to your clinical experience or how you would handle a situation. And they did ask like situation type questions in the interviews. So you do have to like be able to think on your feet and relate to an experience you've had.
Yeah.
Sorry, we totally went off topic.
No, that was actually like the next question was, which you sort of answered, was what type of experience should you have prior to applying? But it was sort of just like having the job, volunteering. Like specifically, do they look for like clinical experience? And does it have to be specifically
Yeah.
in, let's say, in optometry?
There's no specific like hours like other programs. I know PA requires a certain number of clinical hours, but they just really want to see that you have practical experience outside of just the like your courses. They like diversity. Like I worked for private practice for 2 years, but I did a lot of different things there. So that I think was to my advantage, but I know a lot of students who like jumped around from different offices, like did VT, did vision therapy and private practice and like different aspects of optometry, and that was like a good. They were able to pull from a lot of experiences there. Yeah. Do you have anything else to add?
Yeah, I think for the main part, if you have any experience in healthcare, that's also great. I did like the health scholars program at Adventist Health, which had nothing to do with optometry, but I also talked about that in my interview and they liked it because patient care is the same in like obviously it's different when you're looking at the eye, but that's still like the relationship you can build off of like any patient interaction can apply to most settings or most situations. But I do think like it's important to have at least like 6 months of experience working in an optometry setting, because for your like letters of rec, I think it's key to have one optometrist and then one non-optometrist. And the best way to get an optometrist letter of rec is to work for one. So yeah, I think 6 months. And one of the things that they also love is the vision screenings. So just doing like a couple of vision screenings. I know like if people can get in touch with like Lions, they do a lot of health fairs. They do a lot of vision screenings, preschool screenings especially, because most of the schools in their curriculum do have preschool screens.
Yeah, and I'm sure like your optometry club probably also has some kind of connection to make to go to those screenings. I know I found out about them through our free optometry club.
Yeah.
Cool. And then I have like two more just general ones. Like as far as coursework goes, obviously it's a health field, so there's a lot of it. There's like two questions relating to coursework. One of them is, what type of time do you have for other activities? Like taking that many classes per quarter, like in terms of like social life, family life, but also if like you need to work, how much time do you have for that?
The first year I did work. I worked fall and winter. I worked Saturdays for a couple hours, but honestly, like once my spring quarter started, it was I think impossible to work. But I'd say I have
commuted.
Yeah, I also commuted.
Yeah.
But there are other like I have like TA'd like doing work study. Our school offers a lot of TA positions, work study positions. So a lot of students do that, but I think maybe like 1 or 2 students in my class has an actual job, and which is like
Yeah.
Saturdays only.
Very uncommon.
Very, yeah.
Of coursework. And we personally try to go home on the weekends. We live together. So Kristine commuted her first year, and we decided when I got accepted to live together. You can talk more on that if you want. I know commuting is like another beast. But yeah, first 2 quarters I went home pretty much every weekend, but now I try to go back every other weekend. Sometimes my family comes here. And the great thing about being in Fullerton is it's only like 40 minutes from home. So it's doable. And I want to say I go out more now than I did in undergrad because I just make time for it for mental health.
Yeah, so first 2 quarters are relatively easier. But spring quarter, like the workload does get more. And once you have 2 midterms a week, it's kind of just like a catch up all the time. I feel like most people take like 1 day out of the weekend off, but whenever your course load is a lot, like I think first year spring, and then especially second year fall and winter, you're taking like 7 classes, and they're all pretty much like hard classes. So there's relatively no free time during the weekday, like going to the gym, like a little bit, like, but during the weekends, I think like you can take Friday nights, Saturday nights off. But I think, yeah, I think this second year, fall and winter, I was definitely struggling with weekends. But right now, my schedule's relatively easier. So I do take weekends off. I have taken a lot of weekends off this quarter than I previously have.
Yeah.
But you can still make time for friends on a week, like a Friday night or a Saturday night.
Yeah. They need to get on a wait list to see you. That's what it comes down to.
Yeah.
And then last one that I typed down, I don't know if anyone else has any, but like obviously there's like prerequisites or like recommended courses, but is there like any course that you thought like in your undergrad that prepared you the most? Like it's sort of a dumb question, but
No,
That's a good question.
I took like a lot of extra classes just because of my major, but I feel like a lot of I think that was like a microbiome class I took, and just like maybe I didn't take physics in undergrad, but I think a lot of like the chemistry classes, the microbiome classes, those classes helped a lot.
Yeah, I think at UCLA specifically, microbiome was like the closest thing to the level of difficulty here.
Yeah.
Physics definitely became applicable, the optics section. If you guys are interested, by the way, are you guys interested in optometry, or are you like looking more to learn?
I mean, I think everyone's sort of like interested in, I mean, I don't know yet what I want to do, so I'm interested in like everything, but
are there any like pre-optometry students here that you know of?
I don't think so, not explicitly.
Okay, no problem. Yeah, I would say physics definitely comes back. I didn't think it would be as like emphasized, but definitely the optics section at the end of our physics course is like basically taken over 2 quarters here. So that's a pretty big emphasis, and it always comes back in every class. Probably general biology classes come back a lot. Chemistry you don't really use. Like the pharmacology class is very general, I would say. You don't start to learn about the like mechanisms of drugs until later. It's pretty general. So I would say your life sciences definitely are the most applicable.
Yeah, I agree. The coursework just kind of is different than undergrad. It's more clinical application of science, but still just like the science classes where you learn you understand the science and you can apply it, which I think a lot of like microbiome is sort of like that. Any of those classes kind of prepare you